Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Welcome to the Auburn Medical Group YouTube program live stream, coming to you from the Auburn Medical Group. We are Dr. Mark Vaughn
and Dr. Gwen Vaughn. Thanks for joining us.
And we learned this afternoon that he's tall. Today we're talking about a new statement, some guidelines put out by the American Academy of Pediatrics that's been a long time in coming. They have not said anything about childhood obesity screening and treatment as an overall statement in well over a decade.
Yeah.
And this statement that we're going to talk about today is, well, you can see why it took so long, because it is really comprehensive. They went over lots of data.
If it can be described in one word.
Comprehensive?
Comprehensive.
That's a nice way of putting it.
Really long. Oh, that's 2 words.
Anyway, the people who did it...
Repetitive. I'm just going to keep coming up with the words.
It is repetitive. It is. It is. My compliments on some
Convoluted.
things. My compliments on some aspects of this statement that the AAP put out, but it is repetitive, and it is, yeah, it's a pain to read.
Painful.
And there's...
I could do this all day.
There's several... There's 2 different publications that came from it, and then there's the executive summary, which itself is long, and then we're going to go over it. We're going to go over get this, 13, I don't even have that many fingers, 13 key action
Because they wanted to land on a
suggestions.
lucky number? What? I don't get it.
And they totally didn't have to, because one of them is like 3.5 or 3.1, and then the rest are... They didn't have to have it be 13.
It could have been.
Somebody said it can't be 14. I don't know.
14 is just
But we're
too
going to
many.
go over it.
People are not going to follow these guidelines if we make it 14.
The chat is open because this is a live show with a live audience. If you watch us afterwards and want to learn about that, make sure that you subscribe and hit the bell icon. This is something that came.
There.
This came. We're going to open this box at the end of the show.
Oh.
So can I take this off now? This is just to keep it closed, but it's not working.
It's not obstructing me, at least, because I'm tall.
This is from Lindsay Antwine. It's a Christmas. You can look inside. So why don't we jump right into...
Let's do it.
A couple of slides. I'm trying to think, how can we get those on screen? And I'm realizing I didn't set it up in a way that you'd be able to show us the pictures. Sorry. Sorry, can't see the pictures. The first one would be...
I can't say I memorized all 13.
We're going to have to read them to you because
bring them up,
they're in the computer, but they're not accessible right now. Sorry. So these action statements, these key action statements, that's what they are. We're going to go through them. Are we going to go through all of them?
Oh, man.
Maybe we'll just kind of summarize the first 3 or 4. And it's
How about the big ones that maybe are practice changing? Because there are a few
Okay.
that are practice.
So you look ahead while I jump into what the first 3 or 4 are.
Sure.
And it's first of all establishing that over 2 years of age, we need to actually be screening by weighing our patients and seeing how tall they are. And then from that, computing a BMI or body mass index. Right. And then there's some classifications. There's this reference that goes back somewhere that they're using, and you really have to dig to find it. And that's what so-called normal is, because they based this idea of overweight and obese on 85th percentile and above and 95th percentile and above BMI, again calculated from weight and height. Well, if it was just the 85th percentile and 95th percentile, then always, throughout time, 15% of kids would be overweight, 5% of kids would be obese. It's not, though. It's based on some standard that they established at some point and said, this is...
This really had you up in a tizzy earlier today.
Really
I had to talk them down. I'm just saying.
I'm not denying it.
I said, let's go to the CDC. Let's walk this out.
Because
and I said,
when
right
you
here.
Read through this, it keeps referring to 85th percentile for their age and sex, because that's what it's based on. So for all these kids, 2 years old to 18, you're going to have 32 different references for BMI, and it's not even against other kids their age at present. It's against some kind of past set of
when people were more healthy.
I don't.
We didn't have as many.
I don't know
obese
how
kids.
you can see how arbitrary it is where they draw the lines. I don't want that to take away from the good work that they did, though, in establishing we have to draw a line somewhere, and this is a good place. And what they did was look at studies that show that by drawing a line here and saying we need to take such and such action, we'll get into it, kids are going to be better for it. So we're screening, we're looking to see who is at the 85th percentile or 95th percentile, or if they're really overweight, 120th percentile or 140th percentile.
Different class.
That's going to be something else that we talk about. So once you establish that they are at one of these percentiles, if they're over the age of
6,
there's some actions to take. There's some labs to draw up, because you want to check their lipids. You want to see if they even possibly have diabetes already or some kind of problem with glucose or sugar metabolism. And so those are things that would be checked. Were there other things besides just the lipids and the glucose?
A liver test.
Liver test to make sure they're not injuring their liver.
Looking for non-alcoholic fatty liver disease.
NAFLD. So that is something you don't want kids to have, and if they have it, you want to catch it and find out. So that's why there's some testing on kids that are at a certain level. Do you remember what the level is? 85th percentile at age?
I was trying to find it.
Look at the reference here. Trust me, even if I put up these 13 things,
10,
you wouldn't be able to read it on the screen.
10 and older. It is.
Oh, it's 10 and older that we're doing the testing.
Testing 10 and older.
Okay, 10 and older, we're doing the testing for these things to see if we can catch something that's bad. And then dropping on down the list.
Yep. So that's the testing, or the...
Well, what do we do? Well, we need to intervene. We don't just wait and watch. That's one of the statements.
Recognize, test, treat. Those are kind of the big categories.
And treat.
Right?
Treat is by addressing what's going on that's causing this child to be having this risk to their health. Oh, another part of it was the risk. What's the risk? What's the problem? What's the problem with a kid being 120th percentile for their age and sex for BMI? What's the problem? Well, when they look at what happens to these people as adults, go ahead.
No, you can answer. I was going to say, besides where you were going, besides the current risk of, being stigmatized at school and having, psychological changes, that's one thing. But yeah, you were going to go into the long-term effects of being obese at such a young age.
Yeah, they find that blood vessels, large arteries, actually have changes in them when they look at them in the children that are at these levels. We're talking the higher levels here. Changes that don't go away. Even if they lost weight and got to ideal BMI, the changes are permanent. So even as adults, they have a higher risk for heart attack and stroke. Even if they got their weight down to normal, there's still some remaining. So that's why there's this urgency if kids are, in these higher ranges, to take some kind of action. First action being?
Counseling.
And they don't just say counseling. They're really big on this one point, and they make it over and over, that it needs to be a lot of counseling.
Yeah.
They said a minimum of 26 hours of counseling. So even if you're doing it weekly, it's taking an entire year to do it if it's just
pretty much. Well, yeah, if you're doing
half-hour
weekly,
sessions.
Yeah, half a year every week, or
So
doing a year.
This kind of intense lifestyle counseling and diet counseling is not available just in every town. In fact, I think we discovered that you have to go to Lucille Packard Hospital.
Yeah, locally, which is
Stanford Children's Hospital.
That's kind of
they have a program that's a year-long program.
Right, and they have a bunch of different things like the family-centered approach, like where they actually have these different options for the kids, which is pretty neat and not everywhere. So you can probably find a counselor in your area, but to have people who have like extensive training and more than their regular training directed on this, it may be difficult to find that.
Yeah. In addition to that just being difficult for anyone, I do recall that we kind of skipped over some of the, what they call social determinants of health, where there are certain people that just don't have access to good food. They live in what we call food deserts, and oftentimes it's in urban areas that people are having difficulty getting this.
Right.
And so part of the counseling is working with the family to say, come up with ways that they're going to get fresh fruits and vegetables when they're just not available.
not available or just too expensive. Because if you're anybody who's shopped lately, know that when you're trying to get, at the supermarket trying to get those fresh fruits and vegetables, they're expensive.
Yeah.
And if you have kids like my kids, they're gone in 2 days. So you have to go back to the store to replenish those, bananas and the apples, because our kids run through them. And that can be very expensive. Now, that's the nutritious way to do it. It's very easy to just pick up a box of, or a bag of chips, or, a box of crackers, and those will last a little longer. They're a little more filling.
They have the calories, but they don't have the nutrients.
Not nutritious. Yeah. So that's kind of what we talk about, these food deserts, and it's an issue that needs to be solved on. This is not something we're going to do. This is on a more systemic level.
They also talk about, part of their approach, why this was so comprehensive, was it doesn't do any good to put all these recommendations out if they're not going to be followed, if insurance isn't covered counseling, if there's not some kind of effort at helping families to get access to healthy food.
Right.
So let's move on down. We talked about the counseling.
Yeah, that's counseling. If we move on, then we move to
getting a little more serious here.
Actual interventions, medical interventions, which would be like pharmacotherapy or medications.
Actually using medicines on
to
children
help out,
to help them lose weight.
With their weight. This is a fairly new concept, because we used to think, no, don't do this.
We have new medicines.
Yeah, and that's the nice thing. We have safer medications that are okay to use in kids. I would say that this probably should be done through the care of a specialist as well. I personally am not. I treat kids, but treating them for weight loss, I would not feel comfortable
to bring about weight loss.
Yes, yeah.
Now, although we do treat adults with diabetes with these medicines.
We do, yeah. And they're very safe. So yeah, I think probably just a little.
Not the one I use.
Well, you just enjoy giving people diarrhea. That's a good way to lose weight.
The safety. So the safety issue, what you have to look at is what happens to patients who have a BMI in the 95th percentile who don't get the medicine, compared to those who do. And looking at that way, you would say the medicine is safe because the alternative is heart disease that's going to happen. So that's in that sort of big picture, they're safe. So we're talking about children 12 years and older with a BMI in the 95th percentile or higher.
So this is technically obese, not just
by
overweight.
The standard. And they actually recommend using the medicines.
And that is not on its own. They don't say that it needs to be.
In addition to behavior and lifestyle treatment.
Yeah.
And that's actually a Class B recommendation. So,
which is if we talk about these recommendations, that means it's got a fair amount of evidence that it works.
Yeah, that's the next to the highest level of evidence for how good it is. It's above the C and the D levels, which we will be talking about a C recommendation next.
Yeah, which I don't know if both of us are fully comfortable with it, but
I'm not doing it, but I might refer for evaluation.
That doesn't mean you need to be comfortable with it. But anyways, it's referral for weight loss surgery for a child. So these are big interventions. These are surgeries where we're sometimes changing anatomy to help them out.
It sounds like last week's show.
I would. So obviously these are probably a little more controversial and need to be have parents on board and things like that. They probably
not
use
done lightly
the less intervention one, but any surgery is going to have its risks, especially for these kids who are a little more obese. Any surgery is going to be more risky, because obesity can increase your risks during surgery. So that's an interesting one, and grade C. So this is one of those that does not have that better
it's a grade
evidence
C
rating.
Recommendation, not as high as
those other ones that we talked about.
And it's also a older age group too. It wasn't age 12. It was
13.
13 and older.
Yeah.
And was the BMI also 95th percentile, or was it even higher?
This is the 120%.
120th percentile for BMI, 13 and older, grade C recommendation.
Yeah. Now, going back to what we first talked about, where you said, oh, if this is 85% and people over 85% are in the overweight range, how do you get 120th percentile if you're going by that?
Oh, that's right.
Right?
There is no 120th percentile if you're doing it based on today's,
Exactly.
12-year-old females, or whatever the age and sex is that you're checking. That's right.
We didn't even think about that, huh?
Do you see why I was having a problem with it? But he assured me that there is a standard group that's being referred to. It's not just today's. So we can open it up. We put out the information.
Open it up?
We can open this
it up.
Very shortly, we're going to open this up. But we can actually have questions and comments.
Yes.
We haven't had anything.
Oh. Jennifer, we have no.
No.
We rendered them speechless.
Yeah, we have one just says, please hit the up. What does it say? Oh, up thumbs button.
Is it because we're not
Bianca,
actually broadcasting?
Uh-oh.
No, I mean, they're popping up on here, but they're just.
I don't know. Oh, no, it's gone.
Oh, do you need to refresh?
Yeah,
okay.
yeah. All right, we're going. I just paused it.
Yeah.
Okay. So you have a few comments there.
Yeah. Yeah, nothing.
You're not seeing the comments here?
No, I see them.
Somebody commented on
nothing.
my
But they're
Dutch Brothers.
nothing about.
Nothing about
just
the
saying,
topic.
Yeah,
Okay.
Nothing about the
All right.
topic.
We appreciate it.
Everybody's wanting to see what Lindsay sent us. Is Lindsay out there?
She is.
Yeah, I think so.
Okay.
She is.
Here's a box.
Better not be anything inappropriate. Because we have not looked in here yet. If it is, put it in the chat,
We
please.
opened it enough to realize this is a Christmas box. We did read the card from Lindsay. This is from Lindsay. Oh, by the way, speaking of special names, Lindsay, of course, very special, but also Bianca Dye's name will be on the scroll at the end because she found Patreon.
Thank you.
Here's to another great year with Auburn Medical Group.
Another great
Much love, Lindsay Antwine. This was obviously
Should have done
supposed
LOL.
to be
Lots of love.
lol delivered much earlier. However, between Amazon and Etsy, there were some order delivery pickup mixing delays. Anyway, here are the now and wishing you very merry. I'm sorry, missing some words here, but this
Belated.
This is
thank you.
I don't
Appreciate
know. There
it.
you go. It's not too bright if I hold it like that. All right, let's get into it. Let's switch to the
Famous last words.
the Ed camera there, so they can, you can see. Here we go.
So they don't see our reactions.
What?
Oh, okay.
So they can see what we're opening.
Oh,
They're going to see it before we do because I'm pointing it.
Well,
I'm pointing it at the camera.
this is scary.
What is this?
Very exciting.
What? I do hope it's appropriate for general audiences. Lindsay may not have intended for it to be used this way,
quickly turn into a mature show. We did M for mature.
which may be the direction we. Oh, look at that!
Oh, that's cool.
Oh my
It's
goodness!
a doctor one.
Oh my goodness! Look at
Oh,
that!
that's going to be put up somewhere in the
Dr.
office.
Nutcracker.
Dr. Nutcracker.
That's
going.
great.
Oh,
Hi.
oh no.
Hello.
It broke.
What?
That looks like it broke.
You broke it?
I didn't.
Wait, it's turned.
It's twisted like
it's
something
turned-
happened.
Here, I
there.
can show you there. It's kind of.
Oh, okay. I see.
What is that?
That could be.
I think it's supposed to be
Like a book or a
book.
chart or
This guy was just an impulse buy.
impulse
because
buy.
I thought he was so cool. I agree.
That
So
is
cool.
Very cool.
So
Must be an ENT. He's got the.
all he says is that.
That's wow.
Okay,
That's
so
all he needs
next.
to say.
That's all I say as a doctor.
Next.
Come see me as a doctor. That's
Okay,
all I say.
what's this? Like, oh wait, these.
Wait, there's calendars.
Oh, wait.
Oh, this one's mine. It says has my name on it.
Okay, you do yours.
Dr. Glenn.
You do yours.
Dutch.
Show it to the
Bros.
camera.
Oh, I see. It's a Dutch Brothers. Yeah.
Dutch
cup
Brothers
with my name on it.
Mine's a Dutch
But
Bros
if I
cut.
pull that off,
It says Dr. Mark.
it
Sorry,
says
there.
Run 365. A calendar. Another pull-off calendar. I actually got one of these. A pull-apart calendar. You probably don't want to call it that. A calendar like one of these from my family, but it's a national parks one. So I'll put this one right next to it. Now I've got two things to pull.
And-
you've got a cat one.
A cat
That's
shaming.
so much better.
Oh, that is great.
Because of when we did the fat shaming show. We're cat shaming cats with little labels.
That is too funny.
Thank you,
Cats.
Lindsay. All right.
Oh,
my
man.
goodness.
Oh, but wait, there's more. A big one.
Can you pull the...
Yeah. Can you pull that up? I'll pull.
all right. And then there's...
Oh, fancy.
And then there's this. But wait, I keep going left and
There
right
we go.
backwards because it's a mirror image. Okay. I'll lift it up.
You've got a...
What's it? Wait, does it say something?
No.
Okay, here we go.
It's tape.
I think it's just taped.
There we go. Wow, Lindsay, what'd you do?
I got that one. There we go.
Oh my
I
goodness.
think they're burritos.
It does look like a burrito. Is it a California burrito?
Oh, man.
That's a grande California burrito. That's what it
Oh, wait,
is.
we each have one. Look at this. We'll do it together here.
I wonder
This is
if...
exciting. It looks like a tumbler or something.
Be careful. It does. It's like unwrapping a burrito.
It's like we're having a competition. Oh, wow.
Those are
It's like
great.
leather.
That is
A cow had to
amazing.
die. It is a tumbler. It's like a leather tumbler with Dr. Oh my goodness! It says Dr.
With your
Mark.
name. I was just gonna say
Did she spell Gawain correctly?
She did. I was just gonna comment that I got something from one of the local pediatrists that had my name on it.
Did he spell it wrong?
No, he said he put my first name on it,
Gregory.
which I don't go by.
Joy and cheer
Oh,
for
there's
all
something
your
inside.
Dutch Bros drinks.
Oh, let's see. Fits perfectly. Is that how we do it?
Wow.
That is really nice.
Thank you so much. That's so
It's a
kind.
polar camel. High endurance drink. And this is fancy. Man,
What a
feel
great
that.
High
idea.
endurance.
Look at that.
That was a great
Look at what
idea.
Lindsay
know.
gave me. Well, thank you,
Turn
Lindsay.
it that way a little better. Look at
Thank
that.
you. Thank you, thank you, thank you.
Wow.
That is really nice.
That was fun.
Wow. Our audience.
You too can send us stuff. We'll open it on air.
Apparently it can be done. Because
Please,
Lindsay did it.
just let us know if it's inappropriate.
Warn us. Thank you,
We're
thank
happy
you,
that
Lindsay.
was not.
That was wow.
Wow, man,
That's fancy.
That's great.
I'm gonna have to read the instructions on how to wash
Now
this.
I
'cause
get
the
a-
leather. I don't want to get the leather wet.
I know that's the question. Good question.
It probably says on the
Do
card.
not microwave. Hand
Sweat-
wash only.
Sweat-free technology. These don't sweat.
Oh,
Color. Oh, it's got a card or a
wow.
decal. Most styles are cup holder friendly. Hand wash only. Okay, I guess you can hand wash them.
It's just
Thank you.
leather. Leather you can hand wash.
All right.
Wipe down.
So, comments or questions, we can entertain your comments and questions.
We haven't had any yet.
Just that they're having their own little conversation with each other. Hello. Hello, Bianca. Hello, Lindsay.
We don't have anything right
Oh,
now.
I'm sorry. I have a pop-up. Hello.
Rusty B said that's the attending. He was commenting on the little thing there. He says that's the attending's tablet for recording details of rounds and notes on accompanying residents.
There we go.
Yeah.
I'm trying to figure out how.
Resident
Oh,
number
there it
2
goes.
doesn't know anything.
There. Now, I fixed it. Look at that. It works now. She said it was fragile.
There we go.
Thank you.
There we
Thank
go.
you. So we hope that you've learned something about the pediatric guidelines for obesity screening and treatment. And it does look like something we're going to be putting in place. We're not referring anybody to surgery anytime soon. First, a year of the intense therapy.
Right. I've already
26
referred a patient to Lucille Packard for that counseling. I have one of my
Yeah.
patients who's
Up there.
going there. Yeah.
Okay. And then there were a lot of other things that we didn't even touch on about screening for problems like polycystic ovaries and
Yep.
the unique situations with Prader-Willi and so many other things that we haven't even touched on that are included in this very large comprehensive guidelines that was brought out by the AAP this month. And you'll be seeing it in the news if you haven't already, if you're looking at medical news. So until next time,
Yeah. I'm Dr. Wayne Vaughn.
Dr. Mark Vaughn, all of us, and Lindsay Entwine helping us to do it. And Jennifer's here today.
Yeah.
Telling all of you to stay in good health. And hit the end.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.